Hey guys, it's Coach Gaglione here. There's another edition of our Training Around Pain series. Just really quick before we kind of kick things off, I think it's really important that if you do have a really serious problem, that you should get referred out. I'm not a doctor, so this is just some anecdotal evidence to what I found has helped myself and some of the lifters that I've worked with over like the past 10, 12, 13 years. So just kind of keep that in mind. You can check out clinicalathlete.com to find a provider in your area if you have a really serious problem. And if you're in the Long Island area, Dr. Alberry, is a great resource as well. So we'll include some links in the description below if you do have some serious issues. Otherwise, let's enjoy the video. So today we're going to talk about knee pain. And just like all the other joints, we want to look at this from a technique standpoint, a mobility standpoint, strength standpoint, and we're going to kind of give you some kind of quick takeaways. You could provide some temporary relief so you could at least get some training in. So I think when it comes to knee pain especially, this is where kind of supportive gear and your technique and how you do the certain lifts, especially the squat, is going to be a major factor. And I would say when it comes to knee pain, especially depending on the type of knee pain, if it's more in the front or if it's more medial, lateral, like on the sides, there's going to be some changes to the variations that we do and how we squat specifically, and potentially how we deadlift. But like in all of these variations, there's probably a variation and there's a range of motion that you could probably go into pain-free. So we want to try to just go to a range of motion where we're like very close to the pain, but not quite into the pain. So, and I might have mentioned this before in like some other videos, but when it comes to, especially if you're doing like pauses or more isometric type work, if you're doing like a pause box squat or a pause squat, for example, when it comes to isometrics, the cool thing about isometrics is that wherever you pause, you're actually going to build some strength 15 degrees above and 15 degrees below the range of motion that you see. So if you can get very, very close to that painful point and use isometrics, it's actually going to, even if you're like, like a parallel squat, or slightly above parallel squat, you're still going to build some strength a little bit below that range, which is cool. So by adding isometrics into your training program, I think for knee pain, that's why like wall sits can be very popular. So by doing some things like wall sits and things like that, those could be like some really good options for you to kind of train the range below the range that's painful without actually going into that painful range. So first things first, when it comes to technique, obviously in a squat, we want to make sure that the knees are stable. So this could be like a motor control thing, or it could be we'll get into mobility in a second. Let's assume that we have good hip mobility in our hips and ankles for a second. Let's just assume that this is a pure technical or like a motor control problem. This is very common, especially with women and just in general smaller guys or gals, is that the knee is coming in at valgus positions. The knee is kind of knocking in. There is some, and there could be even some mechanical benefits to letting the knees kind of come in to kind of use the adductors, because the adductors actually can help with hip extension. But in general, we're going to advocate the hips being open when we're doing a squat or a sumo deadlift, and basically want to make sure the knees are tracking the feet. So the wider your stance, the more open your hips need to be. So if there's going to be a certain point, if you go too wide, you can see this in a sumo deadlift, you can see this in like a wider stance squat, or especially an equipped squat. If my knees are kind of inside my feet, that's going to put some shear force, there's going to be some twisting on the knee there, which we don't want. So we want to try and keep our knee stacked over our ankle. And I think most people are kind of aware of like knees coming in is probably not a good thing. So especially if you have some sort of knee pain, especially on the inside, you want to be careful of the knees coming in. You want to make sure that you're using an appropriate intensity, so an appropriate load on the bar where you can kind of keep the knees out. And they shouldn't, now at some point the knees are going to have to kind of come in a little bit just to kind of stand up no matter how wide you are, but we don't want to see that kind of dramatic shift, especially coming out of the hole, especially on the reversal. So as your descent should mimic your ascent. It shouldn't be different. You shouldn't have your back collapsing. Also, a lot of times the knees coming in will also happen simultaneously with the back rounding, so sometimes those are kind of, so by engaging the lats, engaging the hips, and shoving the knees out and being more conscious of your your movement pattern and the technical ability of the squat, that's going to help prevent any knee pain, not just now, but in the future as well. So the next kind of thing, which is going to really depend on the person, depending on the type of squatter you are. Like if you're like a more high bar squatter, this can be tough, but at least for the time being, you might need to switch to like a more like a posterior chain dominant squat. So if you are normally a high bar squatter and the knees coming forward is giving you some problems, you may need to switch how you squat for a bit. And you're still going to work a lot of the same muscles. There's a lot of research that shows this. But in general, a squat with a more vertical shin is going to put less stress on the knee because your kneecap is going to kind of sit on top of your shin, just like this. Now, if I just let my knees come too far forward, we're going to get some grinding kind of moving forward. So it's not to say that your knees can't come past your toes. It's not to say that knees forward is a bad thing, but if you're having some pain, especially in the front of the knee, I would advocate squatting with a more vertical shin and sitting back a little bit more and having a more of a posterior weight shift. Now, this may not be possible without doing something like a box squat. So that's going to be like our first go-to is finding a box height, and we want to go as low as you can while controlling the position. So obviously you would start with, this is a high box for me, and you can see I have a perfectly vertical shin here. Now, I might not be able to achieve this position if I took the box away, but the cool thing about the box squat is it's going to force me to sit back a little bit, and I can be a little bit more bent over if I want. So this is going to put more stress on my hips, my low back, but it's going to be less stress on my knee. And if I really want to exaggerate it, I can really sit back and really get that vertical shin. And typically with a box squat, you're going to be a little bit wider. So now, if you're getting ready for a contest, this may not be the most ideal situation unless you're an equipped lifter, which I believe you could, as an equipped lifter, potentially box squat up into a meet if you wanted to. For a raw lifter, I'm not really sure if you could, but it would be a little bit more problematic. But in the meantime, if you're trying to recover from like an injury, this could be so if you're going to find a box height. So let's say this box height is good. You can start to lower the box height a little bit and see if that feels good. And I'm still trying to work on that vertical shin position. And over time, I can continue to lower the box height until I'm back to. Now, as you can see, as I lower the height, I'm going to naturally have a little bit more of a forward shin angle, which is okay. Hopefully, over the course of several weeks, you're able to kind of tolerate the knees forward position a little bit. And eventually, what I would do is once you're kind of comfortable with the below parallel box squat, you can take the box away and just simply start doing pause squats. So why would I want to do pause squats versus a regular squat? It's slowing down the position. It's making sure that I'm in a good position in the bottom. So one of the other things besides range of motion and variation is also the tempo. So you start off with slower tempos and then progress to faster tempos. So just like a normal kind of down and up squat. So a lot of people, especially that kind of dive bomb their squats, are going to put a lot of pressure by bouncing. And again, this is more common with a high bar squatter. So by eliminating that bounce and having a pause, it's going to strengthen the bottom position a little bit more, kind of eliminate that stretch reflex a little bit, and it's going to eliminate some momentum that can cause joint stress. So that's like one of the things, especially if you are a sleeved lifter or if you're a naked knee squatter. A lot of times, you can definitely take advantage of that bounce because you get a great rebound in the bottom, but you're also taking a lot of joint stress. So by eliminating that momentum, start off with pause squats to a box, start with a higher height, work your way down to below parallel, and then eventually to a pause squat, and eventually you can kind of go back to like a normal squat. But in general, slow down the tempo of the eccentric, make sure your groove is perfect, and then eventually you can kind of work on. So you're going to start off with the box with a higher range of motion, start to reduce the range of motion, add in the isometrics, slow eccentric, and then eventually back to your normal tempo squat. So that's the kind of progression for the squat itself. Other things that can influence your technique is your equipment. So I think this is worth mentioning. I think if you're not training for a meet and you're going to work on, like, say, quote unquote rehab and stuff. So I'm at a point now, it's very rare that I kind of do any kind of quote unquote naked knee training. And it's not that I really have, knock on wood, very little knee problems and knee pain. It's very rare. I have more, I would say, issues in probably the biggest issues I have, if you know me personally, is my shoulders. That's mostly due to like kind of a lot of football and wrestling related injuries that I've had in high school that have kind of just lingering in my body. But in general, my lower body has been pretty good. Here and there, I got like a little lower back tweak and stuff. When you put 800 pounds on your back, things are going to happen sometimes, right? But overall, my knees have been knock on wood, pretty healthy. Now, part of that is that I'm more of a posterior dominant squatter. I learned to squat with a box squat. I learned to squat more bent over. So that's probably also why my knees have been healthier. But that's neither here nor there. One of the other things I just tend to take care of my knees using supportive equipment. So why am I kind of going over knee sleeves in this case? So I think that a lot of people, they only really, and this is a more advanced technique, but I think especially for those older lifters, it's worth mentioning. These are kind of, older now, but these are like my tighter and stiffer sleeves, and I could probably get a new pair at this point, but these are stiffer sleeves. These are strong sleeves from Mark Bell. So typically if I'm going over 500 pounds in the squat, I'm going to utilize these sleeves. If I'm doing less than 500 pounds, or if I'm in an off season, or if I'm doing beltless training or high bar work that's like lighter than 500 or like 450, 465, I think that there's some merit to just having a pair of less stiff or looser sleeves. These are the slingshot sleeves, and these also, I think Mark Bell also sells like the sport version, which is just more flexible. So I think these are good because it's just going to keep your knees warm, but not necessarily provide you like too much assistance out of the bottom, whereas the strong sleeves are going to provide a little bit. Now, how much, it depends on how tight it is, but if you have a super tight and super stiff sleeve, and you're kind of coming back from the injury, I would recommend don't use these right away, because you want to be able to feel the pain if there is a problem. So, but this will provide some comfort, some support, but not give you like too much carryover. So I don't think using a light knee wrap or anything like that. I would just use a light knee sleeve just to kind of get the joint warm and have it feel a little bit more protected. And like Mark Bell says, you want to protect yourself before you wreck yourself. So I think just some loose knee sleeves, it's a really simple tip, but I think could be very valuable. The next thing is if you have ankle mobility restrictions and you are a more high bar squatter. So if let's say ankle mobility is the issue, and there's some ways to test this. I think if you refer to our foot video in the description below, you could do a dorsiflexion test to kind of check if your ankles are restricted, so you can assess yourself for that. Most people I've found, unless they're doing like an ATG, ass to grass squat, most people have enough ankle mobility to at least get to parallel or slightly below parallel, in my opinion, without heeled shoes. So unless you're competing in like the USAPL, who has depth standards which are more strict than most federations, most people can kind of get away with squatting in a flat shoe. But if you do have ankle mobility issues and you have, if you're more of a close stance or medium stance squatter and you use a more high bar type technique, I recommend squatting in heeled shoes, because obviously if I lose contact with the ground and my heel starts coming up, that's going to be problematic. So if I start to shift into the bottom and my heels come up, that's going to put more and more pressure on my knee. If I have my good pressure with my big toe, little toe, and heel, the tripod foot weights over my midfoot. Even if my knee is forward, but if my knees are forward and it's tracking my foot, it's still going to be less pressure than if my heel was coming up. So heeled shoes can be effective if you're a weightlifter. If you want to do high bar squats or just ultra deep squats, heeled shoes are going to be good. Now, let's say ankle mobility is not an issue. I think if you are dealing with knee pain and you're trying to have a more posterior weight shift, then the flat shoe is the way to go, because it's going to allow you to sit back more, it's going to allow you to have a wider stance and be more bent over. So if you want to use a more posterior dominant squat, or if you're going to do box squats with a wider stance, box squats where you're sitting back intentionally. So if you're going to squat with a vertical shin to kind of work around knee pain, something like a Chuck Taylor, something like the Reebok Power Shoe. I don't even know if you can get these anymore, but if you can, it's my favorite shoe. So these Reebok Power Shoes are my favorite. So if you want to squat with a more vertical shin, if you want to squat with like low bar technique, wide stance, or a box squat, I recommend using a flat shoe. So all those things can influence your technique and influence just getting out of knee pain. Okay, so from a mobility standpoint, we mentioned before, if you are lacking ankle mobility, that can cause some pressure in the knee. Also, if you're lacking hip mobility, that can cause some pressure in the knee. So in general, with all these kind of training through pain kind of scenarios, you want to look up and downstream. So you want to look above and below the joint, okay? So if you look at our hip video, if you look at our low back video, there's a ton of different drills to strengthen your glutes and your hip rotators, and there's a ton of different drills in there to get more mobility, specifically extension and external rotation. So definitely refer to the low back video, and definitely refer to our hip pain video because there's a lot of overlap in there. But in general, if your glutes are stronger and your hip rotators are stronger, it's going to allow you to. If your glutes are stronger, that's going to do power hip extension. If your hip rotators are stronger, that's going to power through that external rotation moment. So in general, if your hips are stronger and more mobile, that's going to put less pressure on your knees, okay? So the more I can use my glutes and hamstrings, the less I need to use my quads, the less I need to use my knee itself, okay? So in general, make sure your ankles are mobile, make sure your hips are mobile, make sure your hips are strong. There's a ton of, I would refer to our other videos, because your stronger glutes and stronger hips, stronger muscles around the hip is going to also directly impact your knee health. So that being said, especially if you're training around knee pain, more hip extension movements are generally going to be very knee friendly because you're not going to use your knee too much, very little. So things like hyperextensions, things like stiff leg deadlifts, things like good mornings, things like glute bridges, especially like straight leg glute bridges. So anything where I'm extending through my hip, I'm using my knees very little. So any type of, again, RDL, good morning, back extensions, any type of hip extension pattern I could do, pull throughs. Those are going to be great ways to train your lower body without actually having to bend your knee too much, and you'll still get a great training effect for the posterior chain, which is going to help drive your squat and deadlift progress. In the case of deadlifting, a lot of people with knee pain can still usually deadlift from the floor, but for some reason you can't. Obviously, elevating the weights off blocks is probably a good idea, or even doing like a high trap or a deadlift handle. But for most people, going from like a sumo to a conventional deadlift could be a good start, and then going from like a deadlift from the floor to a block pull could also be a good start. The other things to consider is just if you can't, sometimes you might not be able to do compound movements, but you could also maybe potentially do single joint movements. So even doing light leg extensions, I would make sure that wherever the pin is in the machine, try to line it up with your knee joint and make sure that you're using a slow concentric and a slow eccentric. So we're just really trying to flex the quad. So you can do one leg at a time, but basically just again making sure that my quad is active, driving through, getting full extension here. So doing like leg extensions can get some blood in the knee, get some blood around in the quad, and leg curls as well. And again, when I'm doing leg curls, my rib cage and pelvis is nice and secure, and I'm just trying to get the pin of the machine. So I could do these prone, or I could do the leg curls. I could do the leg curls seated as well. I could use bands or machines. So doing isolation movements can be a great way to kind of work around some sort of knee pain. Making sure that my knee, again, is tracking the foot. I don't want to be like too internally rotated or too externally rotated. I want to be neutral when I'm doing leg extensions and leg curls. And I would do these for higher reps, slow eccentric, and a controlled. I don't want to be jerking the stack, and a controlled concentric. So those are going to be all great things for strengthening the area around the knee. And the last thing, we're going to go into some soft tissue work in a second, but I also want to show the TKEs with the band. So the terminal knee extension with the band is, if you can't tolerate leg extensions that well, this would be the next best option. And this is a great rehab movement. But all I'm going to do is just flex at my knees and flex at my ankles. So I'm going to drive my knees forward. Notice how my hips are locked, and I'm going to pull my knees backwards. So right now I'm flexing my quads fully. If you also want a full video, this is one of our gimmicky exercises that actually work videos. If you want a more in-depth video on this one. So all I'm going to do is drive my knees forward and then drive them back. This is also a really great drill if you have struggle like soft knees in the deadlift. Typically these are done with higher reps, and I can also get in a quad dominant squat and then come up. So if you can't, again, go to a range of, you might not be able to go full depth, but go to a range of motion. You're pain free, whether it just be the knee extension or a knee extension with the squat. Again, higher reps here, 15, 20, flexing the quads. So typically with the soft tissue work, this can provide some, again, I want to look above and below the joints. I would look at, maybe you have tight calves, tight quads, tight IT band. It's very, very common. So typically if you have knee pain on one side, the kind of muscles of the tensors fasciolata, maybe the hip rotators, usually is going to be kind of quote unquote gunked up or stiff. You could also add in a floss band. I find that's very helpful. So actually, it's pretty good now, but I had some knee pain on this side, so we're gonna test it out. So with the floss band, you can kind of almost do it kind of like a knee wrap without the cross. But you're gonna keep the knee straight, kind of go up half the wrap. If you're a bigger guy, you may need to use 2. And even though I'm a medium-sized guy now, I could probably still use 2. But just for the sake of the video, I can do the TKEs with the band on as well, almost like a blood flow restriction kind of deal. But I'm just gonna get a tight wrap on this, just provide some compression for the joint. Now I'm gonna go through some soft tissue work here. And typically you can obviously roll, but I also like to kind of tack and stretch or pin and stretch. So once I kind of feel like a little restriction here, I'm going to flex and extend. Which is a lot harder, especially with the floss band on, but you could obviously do this without the floss band. And this should provide some temporary relief, or if you need to squat, you do this before you squat or before you box squat. So this is going to be, now I feel like a hot spot here, so I'm going to hang out here for a little bit. Flex, extend. You can also internally and externally rotate. Now, I would say typically for most people, it's going to be more the hip complex than the calf. You can also check the calves as well. And I can do one at a time. You can kind of roll here and then flex, extend one at a time here. You can also get someone to do like a quote unquote like ex-wife or body tempering for the calves as well, which I find a little bit more effective. So I don't really feel too much there, so I'm not going to spend too much time. And I'm going to take the band off. But in general, you can spend about like two minutes or so on each side. And it's feeling as good as new. So there's some tips and tricks for knee pain, very common. Don't be afraid to work around it, find a pain-free range. And again, like I mentioned before, if it's really a serious issue, please refer out, see a doctor, please, because I'm not a doctor. So this is just some anecdote to what I found has helped our lifters in the past and myself. If you guys enjoyed the video, please subscribe. If you want to support the program, check out the links below. Thank you guys so much for watching. Until next time, stay strong, stay healthy, and I'll see you soon.